Welcome, friends, to Synergy Health Talks. Today, we have an eminent consultant, and he's an imaging cardiologist and a principal investigator. Talking about his professional summary, he's an experienced clinical imaging cardiologist with expertise in cardiovascular disease, advanced cardiac imaging, and clinical trial management, possessing an innovation mindset. He demonstrates a comprehensive understanding of diagnosis and treatment, utilizing a holistic approach to patient care. Committed to advanced skills, knowledge, and embracing cutting-edge developments for optimal patient care. So, friends, today we have a very interesting subject to really, have an insight about. And this is about hemorrhagic myocardial infarction. Over to you, sir.
Yes. So, I'm Dr. K. Vora, consultant imaging cardiologist and principal investigator. Today, I'm going to talk about a latest research in the area of heart attack and its importance. This phenomenon was actually conceptualized for many years since 1990s, and just recently it became like a clinical entity over the last 5 years. It is becoming an important clinical knowledge that may change our practice of heart attacks in the near future. Normally, we know heart attacks as myocardial infarction in medical term. However, today I'm going to talk about hemorrhagic myocardial infarction. So what is that? Heart attack happens because there is a sudden loss of blood supply to the heart muscle due to acute blockage of the coronary artery supply. This is the reason today angioplasty is done on an emergency basis to stop the change to the damage to the heart muscle. However, this heart muscle undergoes a series of changes beginning all the way after angioplasty to over a period of resolution. This series of changes decide who will have full recovery, who will have partial recovery, and who might even lose the heart function over a period of time, even after successful angioplasty. So out of all, there is a specific change that happens in the fraction of patients where microvessels are so disrupted that they rupture inside the heart muscle and cause the intramyocardial hemorrhage. This is what we call hemorrhagic myocardial infarction.
So, sir, this advancement in technology that has happened, as you said, it has been recent in this last 5 years. So, how different is it from the angiography or means the primary stage, the way it is being conducted by a cardiologist? But this process is something additional to that, or it is within the process of angiography that it is being conducted or taken care of during the process?
So what I'm talking about is the disease itself. The process that we do in terms of treatment, like emergency angiography and angioplasty, are the standard of care process that we do in order to save the life from the immediate mortality by heart attack. But what happens in terms of disease process itself, we don't know fully. So what I'm telling you is a part of the disease process we did not appreciate so far. So everything is happening right in terms of treatment, but the disease process that we are missing in terms of heart attack management is the hemorrhagic myocardial infarction, which is the worst form of myocardial infarction. Right now we are taking care of blood supply to the heart. Right. Once the artery is open, we think that everything is done right. But we are still missing a lot of steps in terms of heart muscle. So the muscle is the end organ which receives the benefits of reperfusion, but that's not the case here. Right. And that's what we are now understanding and discovering, that heart muscle, in addition to the vessel, the muscle has to be taken care of also. Because this doesn't happen in every patient, it becomes the fundamental basis of difference in long-term outcomes of heart failure between different patients. Some patients are just ready to go home at the end of 3 days after angioplasty, but some patients are just not doing well. So this is the difference coming from. The problem happens in around 35 to 45% of heart attack patients in US, but it is as high as 70% in Indian patients. So we can say that Indian patients have the worst form of heart attacks. Along with angioplasty, we are actively working towards diagnostics and therapies to solve this problem of hemorrhagic myocardial infarction. Stay tuned for more updates. Thanks.
So, friends, as you heard from Dr. K. Vora, if you have any questions pertaining to this, you may please write to us or call us all the healthcare endeavors. Thank you very much.